It is my pleasure to have a speaker, Dr.C. Balaji, founder secretary of the Metabolic Club, Kumbh Konam, and a fellow of the International Diabetes Federation. Dr. Balaji has been instrumental in organizing several national and regional conferences. Head has conducted the Kumbh Med Con conference consistently. Please welcome Dr. Balaji, sir.
So, respected senior doctors and friends, at the outset, my sincere thanks and regards to Dr. Ashutosh Mishra ji and Pallavi madam for this wonderful opportunity to be part of this CARD Diapcon and at this holy place of Varanasi. So, my topic is on plasma lactate and GPR132 SRC signaling, which has been an emerging diagnostic markers for diabetic atherosclerosis risk stratification. So let me start with a clinical scenario, what we face regularly. A 52-year-old patient with type 2 diabetes, controlled LDL with HbA1c of 7.2. So despite adequate management with coronary angiogram showing significant coronary artery stenosis, it raises a key question. Why do many diabetic patients develop aggressive atherosclerosis despite traditional risk control? So, increasing evidences suggest that metabolic signaling molecules such as lactate may actively drive the vascular pathology. So, with this background, let me start the talk. The global burden of diabetic atherosclerosis. So, patients with diabetes have 2 to 4 times increased risk of coronary artery disease and early onset of atherosclerosis, and traditional biomarkers like LDL, hsCRP, and HbA1c do not fully explain the vascular risk. So therefore, there is always a need for a novel metabolic and molecular biomarkers which has been explored. So what is the global burden of the cardiovascular disease? Nearly, if we just see 16-fold difference with the thing, and nearly 437 million has been affected with the things, and 42.9% increase in males and 28.6% increase in females. So, if we just see the global drivers of change in the cardiovascular disease, so the metabolic risk, the behavioral risk, and the environmental occupational risk, all, there has been a huge growing global crisis with a geographic inequality and with a lot of prevention opportunities. So, we all know the diabetes, what exactly happens. Oxidative stress, inflammation, endothelial dysfunction, atherosclerotic plaque vulnerability, shear stress, and endothelial mesenchymal transition, and the epigenetic changes. So, with this background, there has been a major cardiovascular challenge with respect to diabetic atherosclerosis. What exactly happens? There has been an accelerated pathogenesis, which has been a huge major independent risk factor and a global health impact. So diabetes contributes to a substantial increase with the cardiovascular morbidity and mortality. With this huge thing, there has been an unmet need and a critical gap which needs for novel and sensitive and mechanically grounded biomarkers which needs to address things. So what is this lactate, which has been a metabolic waste product in the things? So traditionally it was considered a waste product. However, modern research shows lactate acts as a metabolic fuel, a signaling molecule, and also a regulator of immune cell function. So elevated plasma lactate levels have been reported in diabetes, insulin resistance, and atherosclerosis. So this high lactate may influence the vascular inflammation and plaque development. So, from a waste product to signaling molecule, we know about the energy source, the signaling molecule, and the epigenetic substrate, which causes the histone lactylation, regulating the gene transcription and the protein function. So, what happens from this lactate? So, first, the lactate shuttle. So, it ferries the fuel between the muscle, liver, and the heart. Secondly, the receptor targets. So it acts on the GPR81 and GPR132. So what are they? G protein coupled receptors Thirdly, the SRC kinase activation. And lastly, diabetic amplification, which leads to increased glycolysis, thereby the systemic lactate surge, priming the GPR132 ARC axis chronically. So, hyperglycemia, increased glycolysis, pyruvate formation, lactate protection, finally lactate elevation, which acts as a signaling molecule. So, in diabetes, hyperglycemia, increased glycolysis, and finally the things what I said. One important thing, the recent studies suggested the lactate may activate specific cellular responses. So, always this elevated plasma lactate has been a signal of metabolic stress with respect to diabetes and also a marker of metabolic dysfunction and predictor of incident diabetes. So, the silent accelerated. So, if you just see fasting plasma lactate averages around 8.1 in diabetic patients against 5.1 in healthy controls. So, nearly 2 times higher value, but yet it has been routinely overlooked. So, this chronically elevated lactate does not merely reflect the metabolic stress, it is actively accelerate the atherosclerotic plaque formation through the receptor mediated inflammatory signaling. So, from early indicator to independent predictor and finally the clinical utility. So, plasma lactate measurement provides a window into the oxidative capacity and the metabolic health in high-risk patients. So, moving on to the discovery of the lactate receptor signaling. So, the major lactate sensing G protein coupled receptors, as I told before, two major things, the GPR81 and GPR32. Among these things, GPR132 has emerged as a key regulator of the macrophage function and inflammation. So, what is this GPR132? So, it is a proton sensing G protein coupled receptor which is primarily expressed in the macrophages and the monocytes, and it has functions of regulation of immune response and control of macrophage activation and modulation of inflammatory signaling pathways. So, there has been a link between the lactate and GPR132. So, the recent experimental evidence shows that the lactate can activate this signaling in the macrophages, and this activation leads to cellular senescence and pro-inflammatory signaling and enhanced lipid intake. So, what are the evidences? So, this landmark study, they just found hyperglycemia, as I told before, increases the lactate protection, and lactate activates the GPR132 receptor, and this GPR132 activates the SRC kinase signaling. These mechanisms finally accelerate the atherosclerosis. So, just flow chart of the thing, elevated plasma lactate, what exactly, how it binds to 132 receptor, and finally the macrophage senescence. So, this is the mechanistic pathway, how it accelerates the atherosclerosis. So, this GPR132 and SRC, there have been the mediators of cellular responses to the lactate thing, and this particular axis represents a direct molecular bridge between the metabolic dysregulation and the vascular pathology. So, this pathway has three things. One is a mechanistic specificity, secondly, a huge clinical correlation, and lastly, monitoring the disease activity. So, this axis offers a potential tool for monitoring the disease progression and also the effectiveness of the targeted therapeutic interventions. So, diabetes accelerated the atherosclerosis through the macrophage senescence. So, lactate, which has been the mediator of macrophage senescence. So, high glucose, lactate protection, extracellular signaling, and lastly the macrophage senescence. So, all glycolysis inhibitors reduces the senescence, confirming the glycolytic pathway and specifically lactate as the driver. So, this critical link in diabetic atherosclerosis. So, the macrophage enters the irreversible cycle arrest and develop a pro-inflammatory phenotype driving chronic vascular inflammation. So this lactate GPR132 axis couples the diabetic metabolic reprogramming directly to cellular senescence, bypassing the traditional aging pathways. So this axis links metabolic stress to vascular structural damage. So targeting this axis for intervention. So there has been a huge therapeutic potential. More and more things have come, and experimental evidence shows that this particular inhibitor thing and this GPR132 receptor and its downstream signaling offer more avenues for drug development independent of the traditional lipid lowering things. What about the future directions? So personalized medicine, which based on this particular axis, could enable more precise and effective therapeutic interventions. Lastly, combining the metabolic control and targeted anti-senescence therapies, they represent a new frontier in managing diabetic cardiovascular risk. So, this GPR132 lactate SRC pathway is a critical mediator of the macrophage senescence and foam cell formulation, driving the atherosclerosis in diabetes. So, this has been a dual diagnostic potential and a therapeutic promise. So, advancing precision medicine for diabetic cardiovascular health. So, there has been a breakthrough with respect to the lactate activated GPR132 axis. There has been a mouse model with the mechanism of the lactate binding this GPR132 on the macrophages, and a plaque instability and the rupture risk has been provided, and lot of interventions with this particular aspect has come. So this is a study in which nearly 8,000 patients follow up, and the hazard ratio was reduced to 1.2 per 10 milligram, and a good control with respect to the risk persistence. So what about a few things about the lactation, which has been the bridging between the metabolism and epigenetics. So this lactate drives the histone lactylation, upregulating the pro-inflammatory genes, and this lactylation peaks in advanced atherosclerotic plaques and co-localizes precisely with this GPR132 positive inflammatory cells. So this, if you just block the lactylation with an alpha-ketoglutarate, they reduce the inflammatory gene expression by 45%. So this is the thing, diagnostic pipeline with triple marker panel, and they found with lactate alone nearly 73% reduction, and when they combine the GPR132 with SRCP signaling, 81%, and lastly when you have both the things, nearly 87% reduction in atherosclerosis. So this is an algorithm which you know everyone, classify the high risk, check the SRCP value, assess the GPR132 and measure the lactate. So this is the therapeutic frontiers which target the axis. So there has been a call to action, turn a silent metabolic signaling into a decisive clinic lever against diabetic atherosclerosis. So the evidence is compelling, the mechanism is clear, the clinical window is now. So a new diagnostic frontier, elevated plasma lactate, interpreted along with evidence of GPR132 SRC pathway activation, they hold real promise as a composite biomarker for cardiovascular risk in diabetes. So with this potential clinical value, unlike the traditional lipid or glycemic markers, this axis reflects the mechanistic drivers of plaque vulnerability. So there has been a future direction unlocking the diagnostic potential with clinical and assay development. So let me conclude by saying that a promising pathway for early detection. So this plasma lactate and GPR132 signaling represent a significant and mechanistically coherent emerging axis for diabetic atherosclerosis risk stratification, one that reflects the true biological complexity of the disease. So thank you all for the patient hearing.
Thank you, sir. Anyone can ask questions.
Their impact on the lactate levels?
No, sir.
Thank you.
It's a long way to go, but it's a promising thing. But as I told before, only just 2 or 3 studies with this plasma lactate and GPR132 axis, but not with the molecules per se, regarding the reduction of plasma lactate and things.
Thank you.
Everything seems to be moving away from dental treatment into, as far as cardiology is concerned, into things which cause inflammation. So, would attending to any path of inflammation take care of all this?
Yes, definitely.
So, should we again go back to our antioxidant models and other things which...
Yes, exactly what you said is true.
Thanks for an excellent lecture. You have struck the right chords in my heart.
Thank you.
This is, a peculiar question. The bicarbonate, including metformin, has the potential to increase plasma lactate, although they don't really cause clinical lactic acidosis. This is very, very rare. Do you think that metformin will be harmful in the long run?
Sir, absolutely, sir. What you said is true. But you speak about the pharmacological aspect of things. But still now, nobody has evaluated the role of metformin with respect to the plasma lactate thing. So, but when somebody will come up with the things and do some real world things with this particular thing, absolutely maybe. Sir, may I add that?
Small bit of comment. Actually, the whole purpose of bringing this talk into the picture was to emphasize in the fact that we have to consider anti-inflammatory therapy, and that anti-inflammatory therapy should be well tolerated, low cost, modifying all those things. So the purpose is we as a clinician should look for fasting lactate level, or if your patient is simultaneously having CKD, that is very, very important. In CKD patient, we are talking of a CKM syndrome kind of integration. So here, once a patient develops CKD, the cardiovascular risk goes way high. It multiplies by 4-fold, 5-fold. And most common cause of mortality in CKD patient is cardiovascular. It is, and after that infection, and after that it is uncontrolled diabetes or hypoglycemia. So main point is to reduce the cardiovascular risk in high risk patient of CKD, as well as in the normal patient who are more prone for producing lactate. They are very, very important. Of course, these lactate has very important function in terms of substrate provider as a reserve energy in a situation. And second thing which is going here is, once you are giving bicarbonate, alkalizing the things, actually it suppresses the inflammation and it stimulates the alternative complement pathway. That is very, very important. Till date, we are not considering complement pathway as one of the modifier for the treatment of the cardiovascular disease. In terms of inflammation, we have only few agents like statin, GLP-1, the other colchicine is also there, but other agents which are immunologically modifying, those agents are very like canakinumab and other things. So the purpose is, in your patient, if the patient lactate level is towards the higher side, give alkalizers like sodium bicarbonate, that is very, very cheap. Target the bicarbonate to 24 milliequivalent per liter, and as sir has said, if fasting lactate level is more than 5, it becomes a risk amplifier. So at the biomarker level, it is one of the things to see, apart from the HSCRP. Second more important point is, if your patient is having residual cardiac risk disease or residual kidney disease, go for blood lactate level as well as urine lactate level. This is also important. If urine lactate level is increased, mitochondrial dysfunction is increased. So you will like to add immunoglobulin. That is another way of treating the things. You will like to add the intervention which will improve the mitochondrial dysfunction. So in holistic way, urinary lactate level, blood lactate levels are very, very important parameter in terms of mitochondrial dysfunction, inflammation and complement. These three are nowadays less emphasized in our therapy. That was the main point. and we don't know what this increased lactate level will do. Mechanistic study, as sir has said, is not available. Yes, sir.
Regarding your question, what we know as far as today is that metformin decreases. One is anti-aging, it's got anti-inflammatory property.
Yes.
Even used in some sort of senescence as well as in terms of
Yeah.
CAs, it has been used. So possibly the way it acts, it will not cause trouble as far as we know today.
Yeah.
But later fewer things will come.
I have given one talk on anti-senescence therapy, metformin as an anti-senescence therapy.
Yes.
If you look at the anti-senescence pathway, it works by 3 and all merges on DDF15, that is one of the important molecules. So here, the starvation is one, that is a pathway, anti-inflammatory is another one, and mTOR is the third one. So there are 3 important
Exactly.
anti-senescence pathway which are there. So metformin may be acting through predominant different pathway. mTOR is the another anti-inflammatory pathway, and lactate one, this SCSC, that becomes a starving pathway. So these 3 are very, very important. What the message is, we have to look for anti-senescence therapy along with the metabolic therapy. So that's what he has said. He has nicely presented to do. That's why I can't resist just standing and giving a compliment to him. So
Thank
it
you.
is the talk of the Cardapon, I must say. Thank you, sir.